Many people associate alternative therapies to herbal treatment, not knowing there are different types of therapies that are taking root in Kenya and especially in Nairobi. Some of these therapies include chiropractic therapy, cupping, hypnosis, and acupuncture. Alternative therapies, also known as complementary and alternative medicine (CAM), encompass practices outside of mainstream healthcare, often used alongside or instead of conventional treatments. Susan Juguna has been receiving different kinds of therapies at the Human Garage, including cupping.
When I came in at Human Garage, I came in with a back pain, numbness in my arms, cold hands and cold feet. The two, I didn't actually know it was a problem until I came here. So when I came in, I thought I'm coming just to get a back adjustment. But Dr. Hamisi explained to me that I need to do it as a treatment of different sessions, and that's where the cupping was introduced.
Susan says she has been suffering from back pain for the last 18 years and receiving different treatments for it.
The very first day, I had very severe back pain. I could not pick anything from down, and instantly the back pain went, and it has never been back. That is about 3 months now.
According to Susan, she hasn't had any side effects from the therapies.
At first, after 2-3 days of the first treatment, which was in mid-November, I got some inflammation. You know, you feel the soreness, you know how when someone goes to the gym, and then the second day, the third day, you feel like you're more tired. I got that. But Dr. Hamisi assured me that that is normal.
Cupping, an alternative therapy, is an ancient form of alternative medicine where a therapist puts special cups on your skin for a few minutes to create suction. The idea is to draw blood to or away from parts of your body. People get it for many reasons, such as pain and inflammation relief, relaxation, and well-being, and as a type of deep tissue massage. It dates back to ancient Egypt, Chinese, and Middle Eastern cultures.
We can use it to help stimulate circulation, stimulate immune system, stimulate relieve pain, help improve joint mobility, help in an overall function of the body.
Cupping as a therapy has gained popularity in Nairobi.
In Islam, cupping is done as Islam and also Hindu. Indians also do it for spiritual purposes. So the Muslims in Kenya, at the coast, here in Isri, Nairobi, have picked it in a very big way and showing it out, and that has also contributed to its popularity and its emerging. And also because it's actually it's very effective therapy.
Chiropractic therapy is another form of alternative therapy. Petheka Ngobeni is a chiropractor at the Chiropractic and Physiotherapy Health Center. She has been practicing for 9 years. She explained who a chiropractor is.
A chiropractor is a professional, it's a healthcare professional who deals with the biomechanics of the spine and the nervous system as well. So we deal with the connections between the spine and the nervous system and the musculoskeletal system.
Petheka takes us through the process of consultation.
We first need to do what we call a consultation, whereby we take the proper history of the patient, for example, finding out about how they got injured, if the issue is about an injury, and what their problem is, and to what extent it's come from. Then after a consultation, we do a set of examinations. In those examinations, it will give us an objective view of what the patient is going through. And then obviously after doing the examinations, that's when we discuss now the treatment protocol with them in terms of looking at what their diagnosis is. And then we do what we call adjustments. That also depends on the patient's history. Some we might find that we need to do further investigations, like send for X-ray or MRI in order to determine the extent of the injury.
Who needs to see a chiropractor?
If you have anything, any problem that has to do with your muscles, your joints, and the nervous system, which are your nerves, then just pop up to a chiropractor and find out what could be the nature of your condition. Everyone who has a spine can come see a chiropractor. There are various conditions that affect children as well. Babies, newborn babies, especially when they're coming out of the womb and now they're coming into the new world. There's a lot of changes that happen. There's also a lot of trauma that happens, which is why we deal with pregnant mothers, we deal with mothers after birth, we deal with children also after birth.
Because they seem more or less the same, people still don't get the difference between physiotherapy, which is not an alternative therapy, and alternative therapies such as chiropractic therapy.
We deal with nerve, joint, and muscle. So with physiotherapy, they deal more with the muscle and joint components.
Gerald Omundi, a physiotherapist of almost 17 years, explains the difference between alternative therapies and physiotherapy.
They're called alternative because they're not in the mainstream medicine. Okay? Medicine itself is very evidence-based. Same to physical therapy. We're very evidence-based. So whenever I'm seeing you, I'll tell you, oh, I'm putting heat, and according to a certain paper, in the last 3 years, it's saying heat reduces pain. Most alternative medicine, for example, acupuncture, Reiki, which is Japanese, the other ones would be Bowen, which is mostly Australian, then osteopathy and chiropractic, which are majorly American, are centered around techniques and not a lot of evidence. They do have evidence, they do a lot of research as well, but we claim, or we work a lot in evidence, they work a lot in how they operate their techniques, which are passed on.
Physiotherapy encompasses various specialized fields, including musculoskeletal, neurological, cardiorespiratory, sports, pediatric, and geriatric physiotherapy.
The one I practice majorly is called orthopedic manual therapy or musculoskeletal therapy, which deals with mostly musculoskeletal problems, so lower back pain, shoulder pain, post-operative injuries, which mostly towards sports or trauma.
Can alternative therapy work hand in hand with conventional medicine?
In cases of people having chronic lifestyle diseases, diabetes, hypertension, arthritis, gut problems, the doctor is case by case basis. If somebody has been on let's say hypertensive medication for a very long time, you cannot stop them in one day. You have to work with their body, work with their dysfunction for some time, and work with your doctor to reduce the dosage of the drugs they are taking, so that as they heal, the drug also goes down, and then they can completely get rid of it.
Get more information. That is what's going to help you to decide whether to juggle both or whether to go for one in particular. Because at the end of the day, it is your decision, it is your body. So you have to be wise in terms of knowing what are the risks, what can happen, what could go right, what could go wrong.
Your health professionals will tell you that you can use physical therapy and alternative, especially it depends on where you are. For example, if you're in extreme pain, you woke up in the morning, bent down, sharp pain, you would be advised to look for a chiropractor. They're very good in quick fixes. Okay, they'll do something, snap, you'll hear a click, the pain will ease off. Okay, the issue is it might reoccur.
There are therapies that cannot be offered to children and older adults due to the risk factors associated with them. One of them is cupping. The therapist's advice on the different therapies that a patient needs.
Fascia manipulation has no age. We actually have fascia. We start fascia manipulation from day one. From 0 day, because you do fascia manipulation even before the ladies, before pregnancy, in preparation for pregnancy, during pregnancy, just before delivery, after delivery, and then also the baby all the way to 1 month.
Is there a situation that it can be risky to do both at the same time?
Yes, it can. If you come here for treatment, for example, and I work and I stimulate the body, and then you leave here and you go and you get inflammation. So you come here, we find your problem is 1, 2, 3. We work on the different points. We cause inflammation. This inflammation will cause a reaction that will heighten your symptoms. So in 2, 3 days after the treatment, you may feel worse than you were when you came to the office. That can trigger fear on the patient. And when you forget that fear, you can rush to the hospital. When you rush to the hospital, the doctor in the hospital, in the clinic where you have gone, has no idea what has been done to you. Okay? Because they don't know what we have done. So they will do lab work that will show elevated blood levels, either inflammatory markers, and they will put you in very high, again, dosage of what? Anti-inflammatory and painkillers. Now it's like you're crashing 2 systems.
Since these alternative therapies are becoming so common and Kenyans are getting to know more about them through social media, are there regulations and policies around them? Pauline Duya, Head Division of Traditional and Alternative Medicine, Ministry of Health, says that in early 2000, the registration of alternative medicine was under the Department of Health Standards and Quality Assurance before it was given its own division.
Around 2014, the Division of Traditional and Alternative Medicine was created, specifically to address the needs of these practitioners.
She says registration of alternative medicine practitioners is done every year.
We have those who have been with us for the longest period of time. So if I can say right now we have about maybe around 50 to 60 thereabout, around 58 practitioners. Every year we have, new ones coming, new therapies coming on board.
For over 2 decades now, there hasn't been any regulatory framework for traditional and alternative medicine in the country.
We have been developing laws and even a policy, which are currently in drafts, and we are hoping maybe by the end of the year or early next year, they'll be out.
If you look outside here, especially in Kenya, it's a sad situation that we have a lot of unqualified people, a lot of people who have zero experience in medicine doing manipulation, for example. The government regulatory authority should be stringent, and the Ministry of Health should also be very strict to curb quacks, because Kenyans right now are exposed.
A chiropractor needs to be qualified from a reputable institution. There are no chiropractic institutions in Kenya at the moment, but there definitely are in South Africa, in America, and in many other countries. So it's very important that a chiropractor is well-based in their understanding of what chiropractic is, because there's so many ways that you can get harmed if you are adjusted without any regulation, without a person knowing what they are doing.
If we could regulate them, especially with policy, they should be registered, because once malpractice happens, it's very hard. Because remember, no one is saying about, was someone prosecuted when our politician got banned? Was someone prosecuted when there are several people who you find they've kept, for example, a child getting alternative medicine while they should be actually getting actual medication? Was it followed up and someone caught? Because they'll simply say it's not illegal.
Pauline insists that the ministry only gives licenses to qualified alternative therapists who have gone through formal training and acquired the needed documents.
We have been licensing them here in our division, but because we need to expand the capacity, we are now moving them to the Kenya Medical and Practitioners Dentist Council.
Over the last decade, the messaging around the benefits of alternative therapy has been increasingly evident on social media platforms as practitioners seek to promote this kind of alternative medicine to possible clients seeking that kind of help.
You start with the social media, right? Or from a person who tells you about it. You listen to them, you check the reviews, you check if they have patient feedback. And then, of course, my curiosity will bring me to the place.
Kenyans are becoming more knowledgeable, which is a great thing. And also, we've seen so many side effects in our traditional mainstream, and of which it's very important to have an open mind and have a way to assess for yourself what you need best. So it's giving them an option out of surgeries and drugs, of which most of the time we do have side effects for that.
The World Health Organization statistics show that 3.5 billion people use traditional medicine globally, and in Africa, about 85% of the population resorts to this option. Utilization of alternative medicine, according to a research, showed that Africa countries lead in the use of alternative medicine by 80%, followed by Chile by 71%, Canada 70%, France 49%, USA 42%, China and Colombia at 40%. Although there are no statistics indicating how many Kenyans resort to alternative medicine, it has definitely gained acceptance in the country, and especially Nairobi, with many of these centers located around Karen, Kilimani, Muthaiga, and Parklands. Nuru Abdulaziz for Willow Health Stories.